And as you know, the next session will be session 2, which will focus on civil society responses to eliminate HIV-related stigma and discrimination. Please, I'd like to ask everyone to take their seats, because we will begin the roundtable shortly. This session will be moderated by Dr. Fernando Martínez Cañavate, who's the Health Director at the City Council of Seville, and Simone Salem from UNAIDS. So I'd like to leave you in Fernando's capable hands.
Buenas tardes.
Good afternoon. First and foremost, I would like to thank the Ministry of Health and Julia del Amo for inviting me to this event, and particularly to introduce the speaker who will talk about the Declaration of Seville, something that I feel very close to my heart. I would also like to thank Julia. We talked a lot today about the Declaration of Seville, about the Seville factor, but many of you may not know who we are and how we work, what we do. Therefore, as a member of Fast Track Seville, I'd like to ask my colleagues, the different representatives of entities and authorities, all those of you who have been working together over the last 8 years, could you please confirm that you agree for me to represent you all here today? So I would now like to speak directly to all of you as representatives of different entities, colleagues, and institutions that participate in the Fast Track initiative. I wanted this opportunity to speak to you. It's been 8 years now, and probably when referring to all of you, I expect that all of the other participants will understand what our strengths and weaknesses are, but I would like to highlight some, and also like to thank all of the participants in the initiative for their work over the last 8 years. First of all, I would like to thank Seville City Council. It's already been said that we're the first city, but I've noted this down. Seville was the first city not just adhering to the Paris Agreement, but as I mentioned to Jorge earlier, we've known each other for many years. And it must have been since we were children, because it's been so long, but I think that Seville was the first city to adhere to the Fast Track programme. And that was back in 2015. In 2016, Seville City Council signed the Paris Agreement. Although it's true that over this period, the municipal authorities have expressed their commitment, not just ours, but also the different departments. I'm referring to this commitment on the part of different political groups. And this commitment is not just related to adhesion to such agreements. Adhesion to such an agreement without assigning the necessary budget is just wet paper. It's true that in principle, or at the beginning, there were financial resources for us to be able to develop our projects, but also to provide social stakeholders or civil society entities. Doesn't really matter what term we use to describe them. I'm sure they knew who I'm referring to. This commitment to transform these goals into a reality, and this was possible because there were certain professionals in the municipal health service who had been working on prevention for many years, and they were behind the political directives to ensure that this became a reality. So I would like to thank Lola. I expect Lola's somewhere in the room, and also Pilar. They have both been important pillars supporting this project that have turned it into a reality over the last 8 years. And of course, I have to mention some of the members of the Fast Track Committee, namely the Regional Government of Andalusia, its Regional Ministry of Health, And I must mention Fernando Lozano. Fernando Lozano is somebody who many people affected by HIV and AIDS in Seville will know. They'll know who he is. He's also very well known nationally. Fernando Lozano is somebody who, much before 2015, when Seville City Council signed the Paris Agreement, he'd been working with tremendous professionalism and impressive human value in his position as the director of SEICIDA and also as the head of the Infectious Disease University at the Macarena Hospital in Seville. So it's important to highlight his role. He was an important contributor, and it's thanks to him we're talking about these subjects today. And I must mention the hundreds of health professionals who, working in the Andalusian Health Service and contributing their humanity and their great experience, have ensured that all of the people who they've treated have improved and achieved a better quality life. So I would like to thank the Regional Ministry of Health for allowing us to be able to develop these initiatives over this period. And I must also mention the University of Seville, a university with more than 70,000 students, and the Vice Dean of Social Action and Promotion of Health also belongs to this team. And this team has been working on important awareness-raising campaigns, training campaigns, organising many workshops. And I would like to think that these people who one day will be professionals, well, the efforts that they're making today will be the reward that we can all reap in the future to eradicate discrimination and stigma. Carmen, I'm not sure if you're there. I'd like to thank you in particular, and also the University of Seville. Well, it would have been impossible for us to achieve real results, tangible results, without the input of community entities, social entities. These are entities, these are organisations that can reach places that the governments and public authorities are unable to reach. People with limited resources, migrants, the homeless, people with HIV who suffer discrimination and stigma. So it's without those grassroots organisations that we would be unable to be here. We wouldn't be able to be here today. So I'd like to thank ADARA, the Atenea Foundation, Valentin. I would also like to thank Médicos del Mundo and also the Triángulo Foundation and Etosida. As you can see, this is a team with representation of the different administrations, which has created synergies and a symbiosis which combines public initiative and social movements, which allows us to work together. We've done so over the last 8 years, and that is where our strength lies. It complements another strength that we have, friendship, because working with friends makes it all much easier. And this has kept us together and united over 8 years. It's one of our great strengths. But another important strength, and I have to thank you all for this, is generosity. We have all placed general objectives within Fast Track initiative as a priority above and beyond the individual and institutional priorities that we may have. And this has made us even stronger. Finally, apart from thanking everyone for their input, I hope that here in the Almirante room, as the Mayor mentioned this morning, it's important to remember that different milestones have been reached for humanity, important milestones in the history of humanity, and I hope that this room will bear witness to the fact that today we spoke of zero stigma and zero discrimination, which we hope will be a reality one day. But I think I would be excessively daring on my part to talk about Fast Track initiative and zero stigma and discrimination with someone like my colleague, here on the panel whose knowledge and experience, even back in 2015, when we launched Fast Track Seville, well, it's true that back then we established many contacts. It was extremely important to develop this flagship initiative. So I had to speak to him as if I would refer to one of these expert bullfighters, Maestro. We cannot understand fast track programs in Spain without taking into account Jorge Garrido, who has led the initiative for so many years. And I will give you the floor to say some words in a minute, but I'm not going to read out the achievements. But he has really helped launch this initiative. Many municipalities are able to work thanks to his support and inputs. And what about the institutional information? Well, Jorge Garrido is a technical director of the creative hub of the Algo Está Pasando hub. He's also a national community coordinator of the Fast Track Cities initiative in Spain. He's a therapist and a management expert in social entities and social communication. He has extensive experience in sexual and public diversity and sexual rights and sexual reproduction, and also in, I apologise as the gentleman, and also to fight for the excluded and for related discrimination issues. So who better to talk about the Seville Declaration than Jorge Garrido? Thank you very much for being with us today. I'm not sure if I had to click on the slides, but first and foremost, thank you very much. And I hope that you haven't had too much to eat and that you're going to be able to stay awake this afternoon and follow the sessions that we have ahead of us. Well, before I move on to the more formal declaration, what's just happened with Fernando really exemplifies the spirit behind the Fast Track Cities initiative and the different workshops and initiatives we've developed in recent years. For the administration and public health services to incorporate all of these objectives from the very foundations, which will allow us to be successful in our objectives. And I think that doing so together has helped enormously. Sometimes administrations are a bit like dinosaurs. They take time to adapt to change. But taking into account people's intentions and wills in our community, when they converge, that is when magic happens. And that's what I'd like to talk to you a little bit about. But I would also like to, I hope that my presence will help the Fast Track initiative in Spain. And this is thanks to the work of the HIV control, tuberculosis and sexually transmitted infections department. And I'd like to thank Julia Delano for her tremendous support leading this process. But today is a day of many emotions. And Julio is somebody who gives a voice to all of these people. So, in relation to the Declaration of Seville, it's a question of placing community leadership exactly in the place where the response has to be to HIV. The UN target aimed for us to be able to eradicate this, and this was thanks to the commitment of the Fast Track Cities, which will promote and accelerate local response to the reality of HIV to achieve the aforementioned goal. The Paris Declaration represented a map for public administrations under the umbrella of the HIV treatment cascade, which encompassed aspects that until now were not such a priority in response, such as the quality of life of people with the virus and addressing the related stigma. HIV is an example of a health response with great clinical milestones, some mentioned today, undetectability and I equals I, but it's also a reference to a deficient background, let's say, experience in terms of psychosocial responses and the way in which we address discrimination, vulnerabilities and the most affected communities. From the United Nations and its political declarations in response to HIV/AIDS, it's recognized the transcendental role of the community fabric in response to HIV and the need to integrate community leadership and innovation in systems, programs and responses to the virus, other infections and sexual health in other countries. community participation has been established as something essential to mobilize public administrations in order to achieve the strategic health objectives set for 2030. If we want to see the end of HIV, and we've mentioned this several times at this meeting, it's urgent that we integrate community action at all levels and decisions, not as a simple consultant, as we've often been, but as another participant at the work and response table. But many people will ask why a community resource is essential. Throughout these 42 years, the communities most exposed to HIV have shown to be an example of mobilisation, together with the social health system, and also of innovation in the response to sexual health in this virus. We've played a key part and a driving force in these research milestones, and we knew nothing that we knew about undetectable equals untransmittable before the partner study demonstrated this. We're also the gateway to the system, to antiretroviral treatment essential for life, to crucial biomedical innovations such as PrEP, which we often refer to as an additional tool, but if it wasn't for the community and our hard work, this would not be integrated in health systems, and also prevention.
Especialmente entre personas que tienen,
Particularly among people who have difficulty accessing such treatment or who do not access the system, guaranteeing something crucial in this conversation, namely the fundamental right to health, especially in those places where the administration itself represents the greatest barrier to access to that fundamental right, and thus guarantee our fundamental human rights. We should never have any doubts. I hope that none of you will ever doubt that the community response to HIV has been and will continue to be a catalyst for social equity. We've also taught the system lessons of life, lessons on resilience, intervention models with the person at the centre, or rather side by side at the same work table, providing solutions, efficient solutions and answers to uncomfortable or difficult questions. We've even successfully adapted our strategies, plans and services to those institutional public health strategies, and also the strategy of fast-track cities acting as a key driver for their implementation in many cities and countries around the world, not just as occurred in Spain. And finally, if there's anyone who knows more about stigma, discrimination, it's the persons involved, the communities that suffer this on a day-to-day basis. There's a claim or slogan, let's say, that we are familiar with in the HIV community: nothing about us without us. And this is ratified by the United Nations Political Declaration to End AIDS of 2016, which includes the following paragraph: community actions give results. They can achieve better health outcomes, mobilise demand for services, reach or ensure people receive services that are difficult to access in formal health systems, support the strengthening of these health systems, mobilise political leaders, change attitudes and social norms, and create an enabling environment that fosters equitable access. If we already knew this, and this was already integrated in political declarations in the Paris Agreement, why is it necessary for us to have a Seville declaration? Well, although the Paris Declaration already incorporated the commitments on the part of the community as an essential response to HIV, a necessary step was required in this roadmap, which would guarantee community participation as a key point. It's essential to broaden the fast-track strategy horizon through a municipal, political and administrative action that truly places people in the community at the centre and institutionally supports our work, efforts, vision and leadership, accompanied by the necessary budget allocations and protected under the necessary legal framework in order to end HIV and AIDS. Because we have to operate within the legal framework in order to guarantee that access to health. But it's also essential in this new prism, or let's say community perspective, to address the mental health of people with HIV and that of the most vulnerable communities, our emotional life, our identities, our sexuality, inequality due to gender, culture, origin and other diversities, which we see violated on a daily basis and which have an impact on our emotional health. Those are the aspects that have to be addressed urgently. Previously, I asked how can we eradicate the stigma, or the HIV-related stigma. This can be done by eradicating the stigma that many diverse people feel. That all social stakeholders ensure that this is something which will allow us to individually achieve our public health goals. It's urgent to end the stigma towards HIV and towards our communities. We have to address a discourse towards diversity, towards the LGBTIQ community and migrant groups, especially towards trans women and men and women, and non-binary people, towards Black, Indigenous and other oppressed communities in our global society. Anyone who's oppressed by inequality and who feels that they're on the margins of society, of the system. It's essential that we address this in the years leading up to 2030, taking into account these realities, our reality, our historical commitment, and the experience of the community legacy that HIV leaves in our society. With this spirit of advancement and community leadership, in October 2022, the Fast Track Cities World Conference in Seville presented the declaration that bears the name of the first Spanish city to sign the institutional commitments of the Paris Declaration. The Seville Declaration includes for the first time specific and measurable objectives relating to community leadership and presses cities to urgently mobilize this community in favour of supporting persons with HIV and a new approach to sexual health in our society. As you can see on the screen, I've included a series of simple principles. They may appear complex to implement. Safeguarding the dignity and rights of communities affected by HIV, meeting UN targets for community responses to HIV, tuberculosis and viral hepatitis, and that's where you can see some percentages that have been established for us to achieve that community commitment and also this response to achieve the end of HIV. We shouldn't only be present in prevention services but also diagnosis services in vulnerable populations, and we have to be the ones that lead these psychosocial initiatives following this diagnosis to improve persons with HIV's quality of life. And also the representation of the community in all areas of our response to HIV, not just when we are looking for trying to identify people to receive treatment, but also to give information about the price of that treatment, access in all of these populations. Additionally, we should also facilitate the follow-up, led by all of these programs, improving transparency and communication. We do this. We put a body and a voice behind all of this. And very often the response we can see on the part of the administrations is very opaque. We need to incorporate people using the same language because for 40 years we've been learning this. We have to develop promotional strategies which will allow us to identify and reach absolutely everyone. If we want to tackle this virus and end it, we shouldn't just discuss this in these meetings. We've got to go out into the streets. We have to support the workers. We have to provide them with resources. We suffer a continual tiredness because very few of us have been able to address this. You know, the epidemic's not the same as it was in the 80s and 90s, and we need to broaden this in a manner which will encourage the public health authorities, the public health services to incorporate more and more professionals. And of course we have to work to end the stigma and all discrimination, related discrimination, connecting all of the communities at international and local level, and we have to evaluate or assess our actions because we don't know if we're progressing unless we evaluate our work. To conclude, to do so at community level, we are aware that the signing and implementation of the Seville Declaration poses even greater challenges for the administration beyond the Paris Agreement, which may even clash with legislation and the principles and our human rights as people with HIV and as communities that are most affected. In Spain, approximately 180 cities have signed the commitment to the Paris Declaration, but not as many have signed this new strategy as occurs in the rest of the world. This is the reason that justifies with greater relevance, even more, the relevance of this common path. And it's precisely that effort and commitment represented by this declaration and its subsequent changes at the legislative and administrative level which will open the door, or provide the key to open the door to ending HIV and AIDS in the world and allow us to improve the quality of life of millions of people and eradicate xenophobia and different transversal stigma. To do this, cities and administrations will always be at your side, continuing to create this community magic and striving on a common path to achieve this objective, the priority for us, ending stigma so that we can conquer the virus.
non acabamos con el tema, no sé por qué. Garrido.
Sorry, yeah, I think it's right. Thank you so much. It's very difficult to speak after you, Jorge. So I think you really made very, very good points that actually I don't need to speak much now, except that first of all I want to say thank you. I can't even believe we're here. I want to say thank you to special thanks to the team that the core team that I was honored to be part of to reach here. Julia, she's amazing. The team from Sicilia, and I'm really honored to be meeting a lot of them today and knowing the great work they've been doing. ECDC and WHO. I feel that, again, you've been amazing colleagues, and that great collaboration that got us here, that will take us further in the translation of the conclusions we are working towards today into concrete actions. So that's really what we should be looking forward from now onward. Something caught my attention today as Spain was joining the global partnership is two words, the global and partnership. Never thought of it in that way, but global is really what we are having here. We're all here, right? Coming from different constitutions, different capacities, different skills, communities, governments, UN agencies, and I'm even knowing that some of the most important as well partners that we work with on the ground are not here, like faith-based organizations, influencers, media people, youth, bloggers, and these are the ones really who had also been helping us in tackling most of the work that we do on eliminating stigma and discrimination. And the second thing is partnership, right? So the partnership, how it is, I always thought if I am to partner with somebody, they should be my equal. Are we equal with our partners? And I'm here speaking about communities and governments. And I really want to commend Spain, because this is what I'm seeing is amazing, that great partnership they have. But maybe this is also what we need to be pushing our communities and giving the civic space for them to do. And within the global partnership, we're trying as much as possible to make this happen and a reality. And also the multi-sectoral approach. So again, I think Nikos was saying, what about how do we change the health system if we're not changing the communities that are part of this health system? If I'm a person living with HIV in a health facility and I'm not even able to disclose my status to other people living with HIV in the same facility because of stigma, the internalized stigma that follows us. So all of that needs to be thought about, and the multi-sectoral approach that we have managed to promote through the work with all the partners is really going to help us to get stigma eliminated in healthcare, in community, workplace, education, and the rest of the settings. And there have been so many champions, and the activists that have spoken today are all amazing champions in changing the social norm. But again, the social norm without the legal reform, I mean, they both have to go hand in hand. So I want to here commend the amazing work the parliamentarians do. So one way of doing this kind of law reform is our engagement with parliamentarians and understanding the vital role. And understanding the vital role that they play. And I'm honored here today to introduce to you the intervention by our esteemed colleague and dear friend, Mr. Marc Angel. Marc is a Luxemburg member of parliament for the Socialists and Democrats in the European Parliament, and he has been serving as a vice president of the European Parliament since January 2023. Since 2022, he has also served as the co-chair of the LGBTQI+ intergroup, the biggest intergroup in the European Parliament. And I have to tell you that Marc also have been amazing in pushing the agenda for ending inequalities in the EU and beyond. And this intergroup is composed of LGBTQ+ members and other key allies. In his capacity as co-chair of the intergroup, he works closely with civil society and policymakers on improving EU laws to better promote, protect, and defend the rights of people in all their diversities. Moreover, as a result of his dedication and hard work over the years to eliminate all forms of inequalities, contributing to ending AIDS, he was given in 2022 the honorary title of UNAIDS Red Ribbon Leader for the 10-10-10 targets, championing the global partnership that we are speaking about today, and also another key initiative with it, which is Education Plus, ensuring that girls and young women are getting education that would help them to access services, that HIV-related services, and protect them from gender-based violence. So I would like to thank Marc for being an inspiration and for all the dedication and commitment over the years to fulfill the promise of ending AIDS as a public health threat. Well, he spoke to me yesterday and he really wanted to be with us today, but unfortunately he has to go to Malta for a Human Rights Council, which I think is also, he is going to be speaking about this initiative and the work we're doing. He's very much committed to follow up that work with the European Parliament and making sure that this is translated also to some legal reform that we're all aiming to see. So without further ado, I'm going to give the floor for the video recording of Marc, and hope you enjoy it as much as I did. Thank you.
Dear ministers, esteemed colleagues, dear friends, firstly, I would like to thank Minister José Miñones and his excellent team at the Spanish Ministry of Health for organizing this timely and important meeting and for your kind invitation for me to attend beautiful Seville. I do apologize for not being able to be with you all in person due to the prior commitments, but I'm very glad and grateful to still have the opportunity to take the floor today by video. Seeing the elimination of HIV-related stigma and discrimination officially on the agenda of Spain's presidency of the Council of the European Union truly warms my heart. Indeed, it presents an enormous opportunity for all of us to contribute to the achievement of the Sustainable Development Goals. SDG 3.3 of ending AIDS as a public health threat by 2030, but also SDGs 5, 10 and 17, respectively, on gender equality, reduced inequalities and reinforcing partnerships in the European Union and beyond. I have personally witnessed the horrific impact of the HIV epidemic, which this epidemic has had and keeps on having on people across the globe. Human rights violation, stigma and discrimination and inequalities generally increase people's vulnerability to ill health and poor health outcomes. Civil society and community-led organizations play a key and positive role in connecting people living with, at risk of and affected by HIV with healthcare services and in advocating for public policies for ending stigma and discrimination. And that is why I co-founded Stop AIDS Now Luxemburg earlier in my career in the year 1990. We've come a long way and made a lot of important progress over the past years in ending AIDS and reducing inequalities, both here in Europe and globally. However, the battle is not won yet. As now Vice President of the European Parliament and the co-president of the Intergroup on LGBTI+ rights, I am oftentimes confronted with serious human rights violations within the European Union and beyond. The overall picture of the HIV epidemic in Europe is of real but fragile and fragmented progress. Whilst overall the European Union is seeing evidence of a decline in new diagnosis rates over the last decades, trends at country level vary and even increases significantly in some countries. There are also alarming increases in new diagnoses among specific groups that are oftentimes still stigmatized and socially excluded, such as men who have sex with men, people who inject drugs, and migrants. Hence, many European countries are currently not on track to meet the UN 2030 targets, and this must change. Let me share with you a few key lessons we have learned from the HIV/AIDS response. One is that intersecting inequalities, such as social, economic, racial and gender inequalities, and harmful social and legal environments continue to drive the HIV epidemic. The people being left behind are those who experience gender inequality, HIV-related stigma, social marginalization, and criminalization. The European Union calls for a union of equality and taking collective action in confronting those inequalities This is critical for making societies more inclusive and resilient, in essence, rights-based societies. Another important lesson is that human rights are central for creating the enabling environment needed for a successful HIV response and central to affirming the dignity of people living with or vulnerable to HIV in accessing quality services. Despite more than 40 years into HIV epidemic, same human rights challenges, including stigma and discrimination, discriminatory laws, policies and practices, gender-based violence, mandatory testing inequalities, and the denial of sexual and reproductive health rights remain among the main barriers to a really effective HIV/AIDS response. For example, the AIDS response has witnessed the harmful impact of discriminatory laws, contributing to the more than 1.3 million people who became newly infected with HIV, and approximately 630,000 people died from AIDS-related illnesses in the year 2022. Indeed, in many countries around the world, discriminatory laws result in people being treated differently, excluded from essential services, subjected to undue restrictions, or criminalized because of their health status, gender identity, sexual orientation, drug use, and/or sex work. Yes, we shall not be able to move much if 60% of the countries that report to UNAIDS still criminalize HIV exposure, non-disclosure, and transmission, of which 12 on the European continent still retain and apply laws, specifically criminalizing HIV, while at least 23 other countries use general criminal law provisions against people living with HIV. 37% of countries worldwide criminalize same-sex sexual relations, and 40 countries still retain restrictions on entry and stay for people living with HIV. One of the most important lessons is realizing the power of the community-led response and the meaningful involvement of affected communities in all its stages. We know that the people-centered approaches are key to an effective HIV and health response. Communities must be able to voice their demands and define their own solutions. And this is where the European Parliament can assist to ensure that EU policies and programs meet people's needs, reduce inequalities, and fulfill the central commitment of the 2030 Agenda to leave no one behind. Lastly, another key lesson learned that I would like to highlight from the HIV/AIDS response is that investing too little and too late has a huge cost for humanity, with millions of additional people requiring services, straining often fragile health care systems, and yielding more costly responses. The European Parliament, under the leadership of the Parliamentary Committee on Development, has been closely involved in this process through its resolution on accelerating progress and tackling inequalities towards ending AIDS as a public health threat by 2030. The resolution calls on the Commission to address AIDS as a global public health crisis and accelerate all efforts to meet the 2025 targets, including through scaling up investments in UNAIDS and the Global Fund to fight AIDS, tuberculosis, and malaria, among others. In terms of the cost of inaction, each year the world delays in fully funding the HIV response. At least 360 billion US dollars are lost because of the economic cost of homophobia due to stigma and discrimination, lost productivity due to avoidable AIDS deaths, and lifetime costs of HIV treatment from avoidable new HIV infections. While adequate HIV/AIDS funding has become even more precarious in view of the early COVID-19 crisis, and now also with the aggression of Russia in Ukraine, the consequences of not investing to end the HIV epidemic are dire. We cannot allow the re-emergence of the HIV/AIDS pandemic. For us to reduce the inequalities that continue to drive AIDS, increased and sustainable funding for human rights and stigma and discrimination programming is required to keep them on the top of the agenda. And it is for this reason that Luxembourg, my home country, a strategic partner of UNAIDS and a member of the UN Human Rights Council, committed to join the global partnership for action to eliminate all forms of HIV-related stigma and discrimination in 2022 as the first EU member. And that is why, representing my country, I extend my congratulations to Spain today for officially joining the global partnership, which has proved to be a critical vehicle for achieving the 10-10-10 societal enabler targets. My deepest appreciation to Spain, muchísimas gracias, for this important commitment. As UNAIDS Red Ribbon leader for the 10-10-10 targets, I look forward to working closely together, and I hope that other EU member states, and I will fight for that, that other EU member states will follow suit and join this initiative to end all forms of HIV-related stigma and discrimination in the European Union, across Europe and beyond. I wish you all a fruitful meeting, full of successes, and I look forward to working with you all to implement the concrete outcomes of your deliberations. Thank you very much. Muchísimas gracias.